autoimmunity around metabolic dysfunction and inflammatory conditions that you all have mentioned about. And today's workshop is all about understanding what is contributing to so much of inflammation in our body, what has contributed to an increase in the number of autoimmune cases today. And we really hope by the end of the workshop, you will have takeaways, you will have time to reflect that, yes, possibly these were the root causes and you never looked into it. And you take that step of looking into it now. So, yes, Siddharth.
Yes, thank you everybody for joining. And while people will keep joining, I guess we need to get started now. Let me share my screen. I hope everyone is able to see my screen. Yes.
Yeah.
So also one quick question before we really get started. How many of you are really aware of the functional medicine approach? How many of you really know what functional medicine approach is about? Okay, Shruti has some slight ideas. Okay. Okay, quite very nice. Some of you are aware. Okay, Jennifer is saying from New York.
Hassan is the program.
Right. Okay. Shruti means working on the root causes of the disease. Wonderful, Shruti. Yes, that's right, Hemlata. Thank you, everyone, for sharing. Okay. So once again, a warm welcome to all of you for the webinar today. We will be discussing a variety of autoimmune conditions like the ones mentioned on the screen, like Hashimoto's, Graves' disease, psoriasis, other skin disorders, rheumatoid arthritis, lupus, ankylosing spondylitis, MS, MCTD, alopecia, and many more, right? It's not important that we go into each disease separately, but what is important is that we understand the dynamics which are behind the disease, right? So with that, let me introduce myself. I am a health coach, I'm an educator. I have been practicing yoga for 20 plus years, been teaching for more than 10 years. So maybe, some people call me a yogi. I have an interesting journey where I actually started in the corporate world. I've done my MBA, worked in the wealth management industry for 10 years. Been there, done that, seen that part of life. But I realized later on that my actual passion lies in health, well-being, and going deeper into spirituality, etc. And that's especially when I started teaching yoga. A lot of people I realized are coming to me because they are struggling with health issues. And although yoga is a wonderful conjunct therapy, it can bring a lot of benefits, but it's not a solution for everything, right? So I started looking for solutions, and that's when many years back I came across functional medicine, and I really kind of felt a deep connection with the concept, the approach of functional medicine, where it always makes an effort to find the root cause of the disease, right? So somebody has, let's say, high BP. It's very easy to prescribe them a BP lowering pill and be done with it. And people are taking BP lowering pills for 5 years, 10 years, 15 years, 20 years, 30 years, right? We all know such people. But why is the BP high? That nobody is asking that question. Nobody is answering that question. So asking the question, why is this happening, is the functional medicine approach, right? So myself and Dr. Ruhi, we came together a few years back and we created this program because we felt that we have something unique to offer to the world and it is sorely needed. And especially after the COVID-19 pandemic, the number of and the variety of autoimmune disorders has increased greatly, and it's still rising. Okay, the incidence is still rising, and the conventional system is not really able to offer a very good solution to this problem. So with that little bit of a basic introduction, I'll hand over the session to Dr. Ruhi, and I'll come back and speak to you towards the end. Thank you.
Thanks, Siddharth. So, a very good evening to all of you. Wonderful to have all of you here and spend a Saturday evening with us. So, I'm Dr. Ruhi Agarwala. I'm a medical doctor by training. And after I completed my MBBS, I realized I didn't want to continue my life just offering people how to manage their health with pills. And that made me look for what else can I do so that I can do better with whatever skills I have earned. And I went for a training in public health. I did a master's in global health where we looked into the preventive side of health. But again, with all the kind of innovations, policies, we are still looking at early screening. But then still pushing people into the mainstream where the solution is still conventional. We are just suppressing the condition. We are not doing anything about resolving the condition. And that quest for really doing what where I'm really able to make a larger difference in the lives of people. Finally, I came across functional medicine, which offered tools to address the root cause of disease. And I studied functional medicine, and it gave me a different perspective from what I learned in the medical school, where we were just trained on how to manage symptoms. Here, we are really able to use the symptoms to understand what is contributing to that symptom. So, yes, so that's where the genesis of my journey in functional medicine happened. And so I founded Functional Medicine Clinic. I'm also the co-founder of Indian Association of Functional Medicine, which is a society where all different kinds of functional medicine practitioners come together. And in this journey, I met Siddharth, and Hormone Reset was a perfect way to bring whatever we have learned to all those people out there who are struggling with chronic issues where the conventional system has said there is no solution. And so over the last few years, we have been able to help a lot of people come out of their health problems. And we look forward to offer what we have learned, what our experiences to all of you who are attending this workshop today. So just give me a second. So when we talk about autoimmunity, right, we understand what autoimmunity is. The immune system is basically now reacting against your body tissues. Now, what has contributed to this? Why has the immune system gone haywire? It was well balanced. It was tolerant. You were in a good health condition. What really has gone wrong that it made the immune system non-tolerant? We will learn about all the various triggers in the later slides. But when your immune system just becomes overreacting, it has started reacting to even small triggers. So it may start with something like, an allergy or an irritation on your skin, eczema, asthma, again, is a hyperreactivity of your immune system. And then conditions like this, if just left unaddressed, basically your immune system starts reacting to a whole lot of things. And that's called an immune dominance. And that's the genesis of an autoimmune condition. And the list of autoimmune condition is long. Okay. Now, on the other hand, if you are, there are infections, and over a period of time, the immune system also gets fatigued addressing those infections. So starting with a simple dysbiosis in the gut, right? It may just aggravate to chronic infections where the immune system has now just given up, right? For example, Candida, the immune system is fatigued, okay? It's not able to uh, fight the pathogen dominance that's there. So that's how immune system, can react in different situations. Uh, in cases of autoimmune disorder, one can have the dysbiosis, one can have the severe infection. So one can have states of an underreactive immune system as well as an overreactive immune system. The most common myth when it comes to autoimmunity, the moment you're diagnosed, the first thing you may be told that it's genetic. And you will start thinking who in your family has an autoimmune condition. And you may not be able to figure out anywhere in your, in your close family, extended family, nobody had an autoimmune condition. Then how come you are diagnosed with an autoimmune condition? So that's one of the biggest myth that you may hear. And the truth is, a person may have a susceptibility to an autoimmune condition. Now, again, this is not for everyone. Some people may have a predisposition to an autoimmune condition, but if you give your body the right conditions, you can reduce that chances. You can turn off those genes. So it's not genetic always. Based on what environment you're giving to your body decides the state of wellness or disease. So the next time if someone says you it's genetic, you need to know what kind of environment you've given to your body. Some people have the best genes, but then because their lifestyle is so bad, you'll see them in a lot of health problems. So what do you do with those genes? So genes can only, load the gun. It's a lifestyle which pulls the trigger. And not always autoimmune conditions are genetic. And the second thing that you will hear is the moment your diagnosis is made that now you have to live with this condition forever. You can do nothing about it to manage, but you only can manage it. Your symptoms will continue like this, and you may be able to manage it with some, with those expensive and powerful drugs. And your quality of life just goes bad, with this entire thought, of course. But then, the entire moral also goes down, that how are you going to live your life with, with this quality of life? Now, now the truth is, if something has contributed to this health problem, if you can identify that health problem, there is every possibility that you can reverse the situation. You were not born with it. So if you acquired it during your life, you will be able to reverse it as well if you take away those triggers in your life. Now, many of you mentioned different names of the condition that you are diagnosed with. Now, the list is long. What I have here is just maybe 10 or 12 autoimmune conditions, but the list is so long because based on which part of your body the immune system is attacking, it gets its name. If it affects the thyroid gland, it's called Hashimoto. If it affects your joints, it's called rheumatoid. The skin, psoriasis. Sometimes multiple organs are involved. And autoimmunity is such that, it will start with one organ. For example, it may start with Hashimoto. You don't do anything about the condition. You're just managing it with a thyroid pill. It will continue. It will start involving other organs as well. So that's how autoimmunity affects your body. And we see people coming to us with multiple autoimmune condition. The reason is nothing was done when the first diagnosis was made. So The names can be long, and usually in the conventional system, you keep looking for that antibody. You have all the symptoms, but then your antibody is not coming positive. Your markers are negative. You are RA negative, but you have all the symptoms of rheumatoid arthritis. But still, you're not being told why you have, what problem you have. We don't have to wait for a diagnosis. Your symptoms are good enough to tell what your problem is and start working on it. So as I said, the genes load the gun and the environment pulls the trigger. And here the environment has a much, much bigger role to play. We know what the conventional thought process is. In functional medicine, it's believed that the kind of environment factors you expose your body to, and this can be the stress levels, the virus, bacteria, fungal infections, parasites, the kind of medications you have been, the fluctuations in the hormone. And when I say fluctuations in the hormone, I'm talking about the cortisol, I'm talking about your reproductive hormones, I'm talking about insulin, I'm talking about the thyroid hormone as well. The kind of deficiencies you are in, and the toxins you are exposed to. All these can trigger autoimmunity in an individual. In an individual who is genetically susceptible, as well as an individual who is not genetically susceptible. Okay. So now if all these environmental factors play a role, and you identify which of these are playing a role in your case, you can reverse the condition. Let's look at the most common causes of autoimmunity today. The first one is the diet you are taking. Now, look at your diet. The diet today is highly inflammatory and it is poor in nutrition. Most of the time, you're eating for the sake of eating, maybe for the taste. It's high in refined carbs. And when I say carbs, it's white rice, it's wheat, it's maida, it's other processed flours. It's rich in sugars in all form. Even the veggies that are chosen to eat today, they are starchy vegetables. Diet is rich in potatoes. Gluten and dairy is like staple in an Indian diet, and both are highly inflammatory. Both gluten and dairy, they are not the native variety anymore, and they are recognized as a foreign protein by our body. So any individual, especially if they already have some inflammation, they continue to take this, it's causing a damage. Processed food. Anything where the human intervention has happened, that food has become processed. So even when it comes to, processed food largely is the junk food or the others. But then even if you see the dal and other things, right? Most people consume dal which is already polished, right? So there is hardly any nutrition there. The oil you're using for cooking, it's rich in seed oils, and seed oils are the sunflower seed, the mustard seeds, and the other seed oils, and refined oils as well. Now, these are rich in omega-6. And when there is inflammation in the body, omega-6 is not what you need. You need to strike a good balance between omega-3 and omega-6. You're not taking any healthy fats. Fats have been made the demon all the while by the conventional system, by the pharma industry. And people have stopped taking ghee. People have stopped taking healthy fats. But your body needs fat. And every cell structure is made up of fat. Your hormones are made up of fat. How do you expect a healthy body without taking healthy fat? You're not taking enough protein. And protein, again, is an important major protein cellular structure of every cell. You're not taking enough antioxidant-rich fruits and veggies. The choice of fruits and veggies have also become so limited. And the most important, our body is 80% water, And the kind of water you're drinking today is dead water. The water from RO is dead water. It's not doing any good. Yes, you're drinking it, assuming it's hydrating your body, but it's not structured, it's dead water. What you need is structured drinking water. Now, one is about what you feed your body intentionally, but your body is also being fed by a lot of things unintentionally, and that's the toxins. The amount of toxins we are exposed to today is huge. If you have infections, it's the toxins from the LPS or the microbial toxins. If you're taking too many drugs, they are toxic because the liver has to keep, trying to clear them off. Veggies, fruits today are loaded with pesticides. Water is affected with pesticides, heavy metals. The air we breathe is polluted. Asbestos, bisphenol, if you're still using plastics, phthalates, again, an important toxin in the plastics. PCBs, PFCs, again, the non-stick, the kind of choice of your vessels in the kitchen, the non-stick pans or the aluminum pans, they all are source of toxins. The fluorides and the SLS in your toothpaste, shampoos, and other products. So that's the amount of toxins we are, probably taking because you're not aware of what is there in the products that you're applying on your skin or you're just inhaling. Heavy metals, it's unfortunate, but we see such high levels of heavy metals when we test the cases of autoimmunity. Aluminium, lead, arsenic, mercury, it's just huge. We have had cases, a very recent case, I would say, a severe case of urticaria, unable to figure out why she's been having this urticaria for the last 6 years. And when we checked her lead levels, it's off the roof. It's really high. Another case of Hashimoto and fibromyalgia, just not able to figure out what's going wrong. And her level of lead was so high. So aluminum is again very common. And aluminum is toxic to the brain as well. Mercury, again, it's neurotoxic. Now, where is all this coming from? You get it from the water, you get it from the non-stick pan, the aluminum pan that you're cooking in, you get it from the vaccines, you get it from the personal care products. So, and once they are in your system, they will bind with the fat because heavy metals need fat to remain in our body. So they bind with the fat and, make their house in our body. So many people who are struggling with lose weight, heavy metals can be a potential reason that is making you put on weight. And yeah, we have seen how damaging heavy metals are, especially in cases of Alzheimer's and Parkinsonism. When we test the heavy metals, they are really high. And of course, they damage your mitochondria, which is the energy house of your cell. You feel tired all your time. Your metabolism has gone very low. Many times, heavy metals will have a role to play. And of course, it does affect your other organs as well. The fourth very important cause, chronic infections. Visibly, you may not have high fever. You may not have the symptoms of acute infection. But when we test the markers, there are markers positive for chronic infections. And these infections can be parasites, right? These can be fungal candida overgrowth. These can be viral infections, EBV, CMV. They are very common viral infections associated with chronic conditions. Lyme's disease, again, very common. Clostridia. Now, you may not have obvious symptoms of these, but these chronic infections are very commonly associated with autoimmunity and other chronic conditions. How do we know this? We look for specific markers in the blood. Your CBC will get very good information about your chronic infections, your ESR levels, your HSCRP levels. Your gut dysbiosis test will give this information. And of course, specific antigens and antibodies for the viral infections and Lyme's disease. So it's very important to clear these infections, because over a period of time, these pathogens become a part of your cell. So your immune system now wants to attack the infection, but it ends up attacking your cellular structure. So that's how poor immune system didn't have an intention to affect your cell or tissue, but then it ends up doing that because the infections have become a part of your cell. Now, with all these toxins, infections, and everything, our poor liver, kind of is struggling to cope up with all that we have bombarded it with. The liver is involved in clearing the infections, fighting the infections, clearing the toxins from the body. Now, imagine if that is what you've bombarded your body with, the liver will struggle. And especially if you have a poor liver health, again, your health will go for a toss. And if your liver health is poor, it will not be able to clear the toxins and infections. The pH of your intestine will be affected. Its ability to clear up infections will be affected, because bile is antimicrobial and that is produced by liver. Again, bile salts work as hormones. So it's very important. It has a very important role to play. And if the liver is not able to do its job, the job of other organs are affected. So it's very important to optimize liver health. So before even we work on clearing infections, we need to make sure your liver is functioning normally. And again, gut health, a very strong connection with all chronic diseases. Many times we even say everything starts in the gut. So something as simple as acid reflux or acidity or indigestion, if you're not addressing these concerns over a period of time, it will start manifesting as chronic health problems, start manifesting as autoimmunity. And this is very common. So there may be dysbiosis, which means your good microbes are, have been outgrown by the pathogenic ones. There may be, as a result, there will be infections in your gut, which can be, again, fungal, viral, parasites, bacterial, or you may be low on stomach acid. You may be having acid reflux, but that is not high stomach acid, that is low stomach acid. And when you have low stomach acid, you will not be able to digest your food. You will not be, the environment of the stomach is not good enough to keep the infections at bay. H. pylori will start thriving. The other infections will start thriving. You may be low on digestive enzymes. And again, when the food is not getting digested, it starts fermenting in your stomach. And when food is fermenting, it becomes a breeding ground for infections. Something as simple as constipation can be very alarming, if left untreated. Because when you're constipated, you're not removing your toxins from the system. It's just getting reabsorbed. And that contributes to a lot of, that's a trigger condition for your body, because your immune system is now trying to target so many foreign antigens in your body, which have been just reabsorbed. And this again contributes to a leaky gut, because so much of toxins in the body will start affecting the lining of the gut. So yes, the leaky gut, and where your gut has just become leaky and everything is just seeping into your system. So this is what a healthy gut is like. Your gut lining, the junctions are tight, and it will only allow the food and the nutrition to be absorbed, and it will not allow anything else to be absorbed back into the system. While your choice of food, the kind of infections, the kind of stress levels, and so many things contribute to leaky gut. As a result, the junction becomes leaky. Everything will just now smoothly pass in and out. Now, certain food which you were never sensitive to, you were never sensitive to, let's say, peanuts or seafood or walnuts or so many other things. You could always eat it very comfortably. Now you see your body is reacting to it. Why? Because it has a leaky gut now. But the good thing is you can seal the leaky gut. You can again go, be healthy again. But you need to first seal your leaky gut. How does leaky gut show like? It's not necessary that a leaky gut will always have digestive symptoms. Well, it may show up as headaches, really chronic headaches, brain fog, you're not able to focus on anything, your skin is breaking out, you just feel tired all the time, you don't have any energy, you feel depressed, you feel irritable, you're not able to lose weight, you constantly feel there is something in your throat, and you feel there is a need to clear your throat all the time, or your sinuses are congested, your joints are achy. You may not really have a diagnosis of arthritis, but your joints are hurting. You may have spasms, you may have stiffness in your body. Fibromyalgia can be one condition. There can be canker sores. You may feel shortness of breath. Again, and so of course, some symptoms, some digestive symptoms, which is very obvious, GI pain, nausea, acid reflux. So again, this is just to tell all of you, leaky gut can manifest in so many ways. It only does not show as gut symptoms. Now, this again, non-native EMF, a forgotten topic, but it is so important today. Imagine we are living in a condition like this, and what it is doing to our body. You have so many electronics in your home, in your kitchen, in your bedroom, living room, outside the house. You're bombarded with so many Wi-Fi. Any electromagnetic frequency which is made by human is called a non-native EMF, and it is damaging to our body. You're working constantly on your laptop and you're exposed to so much of non-native EMF. This is damaging our mitochondria, and you need to have strategies in place to correct or to prevent the damage from the non-native EMF. Whatever I've spoken about, all that contributes to poor mitochondrial function. Mitochondria is a kidney-like structure in cells, which is responsible for cellular metabolism. So whatever you're eating, whatever you're breathing, whatever you're drinking, all that is utilized by the mitochondria to produce energy. Now, if your body is loaded with infections, toxins, you're exposed to blue light, you are drinking bad quality water, you're low on various nutrition, you're surrounded with non-native EMF, all that will damage your mitochondria. And if your mitochondria is damaged, your health is deteriorating. I spoke about water. This is what structured water looks like. But today, the water that most of us drink is unorganized water. And it's largely dead water. We need to switch to structured water. That's what can really hydrate our cell and improve our cellular hydration. And when your cellular hydration improves, your mitochondrial function improves. And yes, many of you mentioned that stress is one of the root causes, and that's what has changed, right? So when our body is in a state of stress, our body will not focus on any reproduction. It will not focus on healing. It will not focus on metabolism. It is not a priority for the body. The body is just seeing you in a situation where it has to prevent you from that, from that danger situation. So that's the only priority for the body. The rest of the thing is not important at all. So imagine, can you be healthy in a situation where you are chronically stressed? You cannot be healthy. So this is literally what your body is seeing. You may be stressed because of, your boss told you something, but then that will just be seen by a body that you are in front of a tiger. It will not be able to differentiate between a tiger and a bad conversation. So, and the body will just prepare you to fight that situation. And today, every other minute you are in this situation. So imagine your body is only in the sympathetic nervous system, where the body can only prepare for fight and flight mode. On the other hand, you have to be in the parasympathetic nervous system mode, where your body heals, your body regenerates. Today, most of us are in the sympathetic nervous system, sympathetic dominant mode. So if we want to recover from our health conditions, we have to switch our body to the parasympathetic dominant mode. So a question for all of you: if these were the root causes, do you think taking anti-inflammatory drugs, taking immunosuppressive medications can alone fix autoimmunity? So yes. Thanks, Hemlata, Ridhima, Neeta, for answering. So definitely not. We cannot recover from autoimmunity if we are only dependent on medications. So I'll have Siddharth come in and take you to the rest of the presentation. In the meantime, you can...
Yes, please.
Yeah, Siddharth, go ahead.
I was just saying, I hope it's visible. My screen is visible to everybody.
Yes, yes.
So, I mean, if you look at the presentation of health issues, we are talking about autoimmunity, we are talking about other connected issues like hormonal imbalances which can result in autoimmunity, and also other way around. Autoimmunity can create hormonal imbalances, and especially for women, it results in issues like PCOS, endometriosis, fibroids, etc., chronic headaches, chronic fatigue, so many issues, skin issues, brain fog. Today, I mean, if you talk to people in their 30s or 40s, everybody's complaining, oh, my memory is getting poorer, I'm not able to stay focused, I'm not able to pay attention as I used to be able to. Normally, it is passed off as, an aging related problem, but our brain is not supposed to age so quickly, right? And then today, body pain, muscle stiffness, breathing issues, sinus related issues, asthma, constipation, diarrhea, acid reflux, so many issues, right? So if our chronic ailments are presenting with such complex symptoms and issues, then isn't it somewhere it is time to change the approach? See, the current approach has brought us to this condition. Let's remember this, right? Where everything that we are doing is just symptomatic treatment. We are not really digging deeper and trying to understand why something is happening and then try to figure out a solution, right? So if that is true, then we have to stop treating each symptom separately. Otherwise, we will stay in the same place, right? This reminds me of a interesting line in Alice in Wonderland. How many of you have read Alice in Wonderland in your childhood? I guess most of us would have, right? So in this, the author says, there's a dialogue happening between two characters, and they say, to stay in the same place, you must run as fast as you can. And to get somewhere, you must run twice as fast. So you can never get anywhere, right? That is the approach we are taking. Just addressing symptom, symptom, symptom. We will never get anywhere, isn't it? So symptoms separately, we need to understand that just popping different pills, whether it is anti-inflammatories, whether it is steroids, whether it is painkillers, immunosuppressants, it doesn't matter what kind of pills. Just going on the pills is not the solution. And let me add supplements to this list of pills because they are also like pills, right? And I would also say that just popping supplements is also not a solution, which today, unfortunately, even a lot of functional medicine practitioners are promoting. So essentially, they're replacing one kind of pills with another type of pills. That's again not a solution because that is not going to address the root causes, right? If we are interested in a real solution, okay, and I'm repeating this again, if we are interested in a real solution to our problems, we have to change the approach. We have to dig deeper, try to get as close as possible to the root causes and start addressing the problem at that level. Okay. How many of you think this is the right approach? You can please reply with a me in the chat. Okay, I see some 10, 15, 20 people are replying. Very nice. Yes, Shrishti, that's our job. How do we know the root cause, right? That's what we are here for. Thank you. Now, all of this may look very complex. It may even be scary to some people, right? Oh my God, it's so complex. How can I ever hope to get rid of these problems? But let us understand that optimal health, good health is not so complex, right? We have to learn to maximize, put in what is required for healing, okay? The raw material your body needs to function and heal, right? It's like oxygen, water, vitamins, minerals, antioxidants, proteins, healthy fats, etc. Right? Dr. Ruhi already spoke about some of these. A strong belief that yes, my body is capable of healing itself. Tell me something. Again, you can answer with a yes or no. Is your body the most sophisticated piece of creation in this existence? The most sophisticated machine? Yes? Yes or no? It is, isn't it? Can anybody argue with that? No, right? You cut your hand, immediately the body starts repairing, and in a few days later, there is no sign of the cut. Yes? Then why can it not heal other chronic ailments? Because we are not giving it what it needs to do that job, right? You have to minimize. You have to remove things that are hurting the body, that are creating the problem, that are not allowing the solution to happen, right? Take out whatever is harmful. Toxins, infections, allergens, trauma. Again, Dr. Rui has spoken about many of these things today. Limiting beliefs, fear, negative expectations. And I'm sorry to say this, but actually our medical system is creating this problem to a large extent. You go to a practitioner with any chronic ailment and it becomes like a life sentence. You have to live the rest of your life with this problem. Yes, a very strong negative expectation is getting created out there. We all know that we have very powerful minds, and actually we are using the mind, the very powerful nature of the mind, we're using it in the exactly opposite way of how we want to use it. We want it to create health, but we are actually creating it, we are using it to create ill health, isn't it? And we have to make it important in our lives, right? You might be able to kind of connect with what I'm saying, that many of us have health issues, but we are still not willing to do what it takes, isn't it? You will see many people like that around you. They have health issues. They will, you, whenever you talk to them, they will talk about their problems only. But you ask them, what are you doing about it? Nothing much, isn't it? Yes. So it is not an important thing in their life yet. They're still enjoying their illness. So if you're enjoying your illness, there is no solution, isn't it? You have to make the healing important. If you want to be healthy and live your life, then there is a possibility that you will find the solution and you will be able to implement it, right? So you have to create an environment for healing. You have to give importance to sleep, to proper rest, to proper laughter, joy, stress reduction, etc. in your life. You have to exercise, you have to stretch, you have to do breathing properly, right? Everything. You have to have meaningful relationships, positive visualizations and associations. You can't keep thinking about ailment, disease, and expect your mind to help you create a solution. It doesn't work like that, right? Whatever you focus your mind on, it will create that. If you want to create health, you have to focus your mind on that. And that will only happen if you if you give it a lot of importance in your life. Yes. So coming to functional medicine, it is an integrative system. It looks at the body as a whole. The effort is to identify and address the underlying root causes of any imbalance or dysfunction in the body. Yes. When you actually address the cause of the problem, the condition will start reversing, right? Because going back to that ability of the body to heal itself, the moment you start giving the body what it requires to do its job and removing whatever is obstructing the body, healing will start happening. It's no rocket science in that sense, right? The body always is trying to heal itself. If you support it properly, it will do its job, right? So in a nutshell, we can say that we try to treat the whole body, not just the symptoms. That's a major difference. So functional medicine approach encompasses a whole wide range, a whole gamut of factors that impact your health, right? Whether it is stress, whether it is your digestive system health, whether it is your emotions, whether it is toxins, whether it is lack of exercise, mental issues, spiritual issues, supplement requirement, nutrition not being proper, whatever, right? Relationships, sleep, rest. It's a very, very integrative and holistic process and approach because all of these and more factors impact your body. They impact your health, isn't it? And if they're impacting your health, they have to be taken into account and addressed. So we offer a 12 weeks, let's say 3 months hormone reset program in which we look into the unique root causes of autoimmunity or any other ailments, okay, that you might be having, any other imbalances you might be having. Here is a sample of what all different things that we address. Toxicity, including heavy metal toxicity, chronic infections, deficiencies, inflammation, poor gut health and function, mitochondrial dysfunction, poor detoxification capabilities, poor stress coping skills, non-native EMF exposure, hydration, and so many other things. We help you address through this program. Now, another thing I want to mention here is that the conventional system of healthcare is focused on managing the disease. If you manage the disease, are you going to get rid of it? No, isn't it? Whereas we are interested in creating a possibility, a situation where the body can reverse the problem, where it can heal itself, right? So the process begins with a very detailed taking of history and symptoms from you. Based on this, we suggest tests, what tests you need to do. Once you submit this information to us, we will process this and come up with the root cause analysis. What are the factors that are creating this problem for you as a unique individual? And then we create a personalized treatment plan, which includes a nutrition plan, which includes lifestyle recommendations, supplement plan, gut and liver support, and whatever else is needed, including detoxification, etc. The process involves 2 one-on-one consultations with us. It includes reassessment and realignment. If any changes are needed midway, we will reassess and make those changes. We also include certain simple but very effective and powerful meditation and stress management techniques and practices. Okay. We take you through a 3-day guided detox process during the program. We also have created and we share videos on different health topics, things that are important for you to understand if you have to become healthier and stay there. Apart from the 2 one-on-one consultations, we also have 8 live sessions like how we are having right now on Zoom, with obviously a small number of people who are registered for that batch. We have 8 live interactive sessions to empower you with information, knowledge, and motivation, and to answer whatever questions you might have at that point of time. We offer real-time support and hand holding. There is a WhatsApp group that will be created dedicated to the batch, and whatever questions, doubts you might have, you can use the group chat to ask, and our team will solve those issues. Okay. We also offer all kinds of support, shopping list, handouts on various topics that you can study and understand better, access to dozens and dozens of nourishing and tasty recipes, etc. So it's a very, very carefully structured design program that will definitely help you move towards better health. So once you start on this journey, what are the signs that you're healing, right? Very quickly, you will see your energy levels start improving. Things like headaches or body pains will start reducing or maybe completely go away. Your sleep will improve, periods will improve, skin will look much better, you will have a glow on the skin. Your food cravings will reduce, your digestion will improve, bloating will be reduced, bowel movement clearance will happen easily, and you will be less puffy and inflamed, very, very importantly. Okay. Now, we will be starting the group sessions of the next batch in October. Why we are saying this is, the group sessions, the 8 live interactive sessions, they will start on a certain date, okay? But your treatment starts whenever you register and sign up. So the program cost for the group program is 14,000, but till tomorrow morning, for the participants of this webinar, we are offering a discounted price of only 12,000, okay? This is till tomorrow morning, 10 o'clock. So we have a group program. We also have an individual program which is focused towards men. The group program is only for women. Individual program, the cost is 15,000. We obviously don't have the interactive consultations during the program. Here also we are offering a 2,000 discount. I'm sorry, this is a 3,000 rupees discount, and it comes to the same price of 12,000. So that's all from our side. Any questions, we can look at them now. Okay, before that, give me a moment. We wanted to show you a couple of a short video with testimonials of some earlier participants. In the meanwhile, Dr. Ruhi, can you share the poll with the participants?
Yes. So all of you, we will open up for the Q&A where you can unmute yourself and ask your questions. But before that, we are just launching the poll. It will take you less than a minute to answer the poll. And I request all of you to answer the poll so that we know if you want us, if you want our help in any way, if you want a team to connect with you. Yeah, Siddharth. Done. Okay, so while all of you answer the poll, I will unmute those who have already raised your hand. Okay. Shruti, you can unmute yourself and ask your question.
Hello.
Yes, yeah.
So, doctor, my sister is 23 years old, and she was diagnosed with Addison's disease and at the age of 10. So she's on steroids since then, and they have told that it's an autoimmune condition. Can that be uh, recovered, or can we stop the steroids after this sessions?
So yes, so it will be a process. We cannot stop it, overnight, but it has to be a process of tapering off the steroids. Okay. So we will have to identify why there is autoimmunity, why autoimmunity has developed in your system. So we will look at we will evaluate for all the possible root causes and then as we address the root causes, the requirement of the steroids for her will start coming down and then we taper it off. Are you there, Shrishti? Okay. We move on to the next person in the queue. Shweta, are you there? You can unmute yourself. Shweta, can you unmute yourself now?
Yes, I do.
Okay, yes.
Mine is actually last October I have diagnosed with autoimmune.
Okay.
It was impacting my brain actually. My brain was inflamed, and due to that, eye nerves was impacted. So due to that eye nerves, my vision was completely slide down. And doctor has put me on steroids. I was on steroids for 1 month. After that, I have stopped. For next 6 months, I was not. I was completely normal. I didn't got any symptoms. But after 6 months, again, it was the same issue. Again, brain got inflamed. Again, it's a vision issue. It got impacted on eye nerves. So it was the same
Yeah.
issue. Then I didn't stop the steroids. Almost from 3 months, I'm on steroids itself. Now I'm on 0.5 mg of steroids. I didn't stop. But before this, I got tinnitus in the left side of the ear. I don't know why it got. Why due to some virus? I don't know. I have met many ENT. They told there is no treatment for this. It should get stopped on its own. Is there a relation between this tinnitus and this brain
Yes.
inflammation? Because from past 1 year, tinnitus is not stopping. It is continuous actually.
Yeah. So
So
tinnitus is one of the sign of autoimmunity. We have a beautiful blog on our website, hormonereset.in, on tinnitus, which was published just last week. You should definitely read that blog, and it's an indicator of autoimmunity. Okay. Now, you took steroids for a few days and then you stopped it, and the symptoms are coming back, right? So that's how the trend will be if you are not doing anything about autoimmunity. Okay. So you will have to work on correcting, the possible causes of autoimmunity. And as you do that, you will not need the steroids.
yeah, at present I'm on 0.5 mg. It is very less actually. And one more thing is, doctor has done all the tests, including TB virus, HIV, every virus test doctor has done, but they didn't diagnose for what reason it is developing again and again. So,
See,
so that
now, Shweta, there is also now when we look from the conventional point of view, okay, we will look at the lab range. We will see, okay, your markers are within the lab range, it's normal. Okay. But when we're in functional medicine, we look at optimal values. Just by looking at the CBC itself, we will get so much of information, which can be correlated with the person's sign and symptoms. Okay, so the report that actually may appear normal according to the conventional ranges may not actually be normal.
Okay, I have done my blood test day before yesterday. If you need, I can send it, or I have sent it to Tushar as well. Blood reports.
Yeah, so Tushar will get back to you then.
Okay.
We will
He
have a
has
look.
told me that doctor has verified your reports and doctor told it's autoimmune condition. So, but I wanted to attend a workshop, so that's why I have joined.
Okay, yes, I remember him sharing your reports then. I didn't remember the name, but yes, he had shared the reports with us and we had a look. Yes.
Yeah, we do. This will be reversed or it will be continuous because I have developed again and again, right? So, will this be reversed?
So when we talk about reversal, it's an ongoing process. Okay. You cannot just focus on your health for 3 months and expect it to be reversed for life. That will not happen. Okay. The efforts you make in correcting your lifestyle, in your diet, etc., will have to continue for life. Once in a while, here and there, you kind of, skip certain things, that's okay. But then the efforts have to be continuous. And that is what will make you come out of that usage of drugs. So you can reverse it, but then you also have to, kind of put in that efforts, consistent efforts.
So we have to maintain the same diet for lifetime.
Yes, so it's a choice you make between medications and a life without medications.
It is best to maintain that itself.
Absolutely.
Okay, that's
Okay.
all. That's all.
Okay. Thanks, Shweta. Sonia, you can go next. Please unmute yourself.
Hello, ma'am.
Yes. Hi.
Ma'am, I have a thyroid and I have a Sjogren syndrome. So, a doctor told me for steroid, but I'm not taking any steroid right now. But my condition become rushed. So, I'm asking you that only the immune system can we reverse our immune system, or we can only reverse our disease.
Okay. Now, see, we are not reversing our immune system. We need our immune system. Okay. We need a healthy, tamed immune system. An immune system which is balanced. It does not react to things. Okay. So we need that kind of immune system. And yes, we can bring back our immune system to that state. And when we
Okay.
bring our immune system to that state, that's when we reverse the condition, reverse the autoimmune condition.
Autoimmune can I'm asking ma'am, autoimmune system reverse or we cannot reverse, we can only reverse our disease.
So where is the disease coming from? The disease is coming from autoimmunity.
Yes ma'am.
So when you reverse autoimmunity, your disease will also reverse.
Yes, but we should take a healthy diet for lifetime for that.
Yes. How can you expect if you're taking a bad diet? How can you expect your body to be healthy?
Okay ma'am.
Okay.
Okay, thank you ma'am.
Okay. Who's next in the queue? Amruta, sorry, Siddharth.
Number 5, Debashri.
Okay, I'm seeing a different number at 5. So Mamta, you can go next.
Hello, ma'am.
Yes.
Ma'am, I've been suffering from rheumatoid arthritis since 2 years after my daughter was born. Just after 2 months of the birth of my daughter. Since then, I took steroids for like 6-7 months, then methotrexate, and finally taking biologics since 1 year now. My situation is currently like very much stable, but I want to taper down the drugs. But whenever I try to taper down, the symptoms really came back. I feel like flared up situation. So I'm really tired of this. I want to get rid of the medications. And meanwhile, I've tried like vegan diet and raw vegetables and all, but I start getting headaches. So I'm really not able to follow that diet very religiously. So I really want some motivation, and I want to know, does all these things really help? And like one day I'll be get rid of all these things, or like just I don't know, like these things will 100% do correct the like this disease thing, and I'll be able to get rid of the medications.
Okay. So, Mamta, now we see this very often that post-pregnancy, post-delivery,
Yes, ma'am.
women are diagnosed with an autoimmune condition.
Yes,
Okay,
ma'am.
it's becoming very common. Now, just understand that pregnancy is a demanding situation for a woman's
Right,
body.
ma'am.
And if the demands are not met, there can be deficiencies, and it's an increased stress on the body in a positive,
Yes,
not in a negative way. Okay, which is, if not handled well, there can be consequences. Okay,
yes, ma'am.
you've been on medications, but when you taper down, you see your symptoms coming back because
Yes,
you're
ma'am.
dependent on the medications. You're not doing anything about the autoimmunity. So only when you do something about addressing the autoimmunity and you taper the drugs, that's when you will not see the withdrawal symptom of the medications.
Ma'am, I have like cut down on gluten and dairy, like 70% of these things I've reduced. But yes, I will agree to this that I'm not able to like 100% stop them. But I do feel like little relief when I do regular yoga and non-dairy, non-gluten diet. But
Yes.
yeah, after like 2-3 weeks, I again come back to the original things, and I think I lost the track every
Right.
time.
So that is very common again, that you are motivated for 2 weeks and you come back to your original. And that's where our program helps, because we have the hand holding, we offer that community, we offer that support so that you know what are the options you have to eat
Yes, ma'am.
when you are on a healthy diet. Because people usually think, what will I eat if I give up gluten? What will I eat if I give up dairy? Even at
Yes, ma'am.
30% that you are saying, 70% you are off, but 30% you're still taking gluten and dairy. That 30% will do the damage what 100% will do.
Okay.
Okay. And the second is, if your gut health is not good and you're taking raw food, it will cause you trouble.
Okay. So raw food is after proper gut healing.
Absolutely. Yes, yes. Raw food will not suit everyone, especially with someone with an autoimmune condition. It will be difficult.
But ma'am, I joined some program for this autoimmune condition only. There, they like straight away get me onto this raw veggies, where like raw spinach, lettuce, and everything raw, nothing cooked. So after like one day I could do, next day I got migraine so badly that I had to take like medicines for next 2-3 days. So I tried for 2-3 times, but again I ended up like having medicines for 2-3 days. So it was not a really good situation.
So, Mamta, again, the question is, was that protocol really personalized for you?
Ma'am, that protocol was for autoimmune condition only. Yes.
So it's not personalized.
Okay.
Every individual is different who has an autoimmune condition. So based on how good the gut health is and so many other parameters, based on the reports, we will have to design, the kind of diet for
Okay.
them. So, okay, I hope I've answered your questions. We on to the next one.
Sure, ma'am. Thank you, ma'am.
You can unmute yourself.
Hello. Hello.
Yes.
Yeah, actually, I have a two-part question. One is, my father sister-in-law is suffering from Meniere's disease. Is it an autoimmune disorder?
I'm sorry, which disease?
Meniere's. It's an ear problem where, vertigo and tinnitus and one more thing. All three are combined. So, he has this sudden falls sometimes, so which is very scary. So I just wanted to know if it is an autoimmune disorder.
See, beyond a point, it doesn't matter, right? Whether it is autoimmune or not. There might be an autoimmune component, and there might be other things at play as well. What matters is that we are able to understand what's happening with this individual person and help them to get better. Yes.
And another question is that my sister-in-law, she is suffering from Wegener's granulomatosis. Okay, and actually she had this earlier, a few years back, but then within 2 to 6 months, it went into remission. But unfortunately, this year, about a month back, it came back again. But this time, it's affecting her brain a lot. In the sense, she's on steroids, she's on immunosuppressants, and there's this constant headache which goes beyond tolerance every day at a particular time, same time. It's around 3 a.m., 4 a.m. And that time she says that, she just begs us for any drug that can reduce the pain. We've gotten many tests done, like MRV, CT scan. Many doctors said it's migraine. We took medication, but nothing is helping her. So I'm just very concerned, what is the issue? Every report is clear. So we don't know what is causing her.
If she's diagnosed with a condition, her reports cannot be clear.
But
Either the interpretation of the report has not been done properly. You've just looked at the lab ranges, and the second, enough detailed investigations are not done.
Okay.
So yeah, so it
It's a
can
very
be
common problem. It's a very common problem. I think Dr. Ruhi covered it actually during her presentation, that people will have all symptoms of an issue, but the report doesn't agree. So, the doctor will say, you're fine, everything is fine. It cannot be fine because you have those issues, isn't it?
Yeah, because it's beyond tolerance. She cannot tolerate the pain at that particular time.
So it doesn't matter what the reports say. Either they are not interpreted properly or the right reports have not been run. They're just focusing on the symptom, where the symptom is. They're not focusing on different parts of the body to see what's happening overall. And that's a very common thing. That's the approach, unfortunately, that we were discussing.
Okay. Thank you.
Who's next? Shrishti's question is answered?
Yeah, Shruti. Shruti, you still have any question?
No, I don't have any more questions. Thank you.
All right. Okay, so Debashri, you can go next.
Yeah, hi.
Yes.
Actually, my problem is recently I got diagnosed with low cortisol, very low cortisol, at approx 1.65 morning and evening. So it's not Addison primary. I'm not sure if it's secondary or not because my doctor didn't diagnose with it. But the thing is that I got some bad, my skin is getting ruptured, similar kind of like Cushing's, but it's not Cushing. And blood was coming out. But after continuing my hydrocortisone tablets for 20 mg for about a month, not approximately a month, at least 20-25 days, I think. Everything is okay right now. But the thing is that I got my weight gain very much. In the last month, I got approximately 21 kilos in 1 month. And I'm a very active person. I'm a professional trainer also. And I used to play sports and everything. So my lifestyle is very good. But unfortunately, this past month, 21 kilos in a single month, of course, it's stressful for me. But the thing is that right now my stress is managed because I do yoga every day and everything. but the thing is that I couldn't understand why my weight is getting so big. And my doctor also given me TSH test, which I didn't do right now. I will do after a week, as per my doctor's advice. And so this is the reason I want to ask that for low cortisol, is it really a possibility like this type of abnormal weight gain, and my weight changes so many times? Like for the first half of the month, it was like 10 kgs increase. Then within 6 days, 6 kgs decrease. Then in 3 days, again 7 to 8 kgs increase. Like so many fluctuations in a single month. So this is the reason I want to ask.
That is not a typical symptom of Addison's disease, Devashri. So, I mean, I don't have we don't have enough information right now to really say what's going on, but this kind of a weight change is not a typical symptom of Addison's.
Okay,
Actually,
but my cortisol
weight loss is considered to be a common symptom.
Exactly. So that's why my
So something
doctor
else is
was
going on.
confused.
Something else is going
Yes.
on, and as we were talking in the last question, right, that either the right diagnosis has not happened, right testing has not happened, or it's not been interpreted properly.
Actually, I have some history of, I know the root cause, the heavy metals and steroid use. It's not from my side. Somebody gave me in my food without my knowledge for about 6 to 7 years. So as per my doctor, it is the effect of those certain kind of chemical poisons in my system. And from there, I got this kind of scars in my body. My my cortisol is very low. And yeah, that's the thing. So I'm a little confused.
So, Debashir, I mean, there's a lot more that is going on, than what is just visible in your case. And yes, if we look into it in details, we can definitely be able to find an answer for your question. But right now, it would be not appropriate if we say anything.
Okay, so any kind of test you can suggest, like for heavy metals or something like that? Because I think it's arsenic. As per my knowledge in this subject, I
Yes.
think it's my possibility. So any
Yes.
test?
So you can do a hair sample analysis, which will give the details of the heavy metals in the tissue. It will also be good to test the heavy metals in the blood as well, so that we know what is floating in the blood and what is in the tissues.
Okay.
Okay.
Thank you.
Yeah. All right, Pooja, you can go next.
Hello, ma'am. I am Pooja's husband talking on her behalf.
Okay.
So there are multiple disorders that she has. So the history goes down back to 13 years ago when she was diagnosed with a thyroid. Then she got married to me, and after some time she got migraine, and it got so severe that once in a week she had to take Nimesulide to get rid of her migraine, and she is so much dependent upon that medicine. Then after some time she got vaginismus, and post that, like maybe a few months after that, she had some gut issues. Actually, she was allergic to H. pylori. There's a bacteria in the water, Helicobacter pylori, I guess. So she got allergic to that, and now finally, yesterday itself, we came to know that she has Hashimoto disorder, Hashimoto thyroiditis. So there are multiple problems that she's been going through right now, and her antibodies level is over 1000. So we are quite actually concerned with that. So my question to you that is, will we be able to tackle all these problems one by one? Like what approach will be followed in her treatment?
So, okay. Now, if you look at her history that you just told us, right? The first thing you told was she was diagnosed with a thyroid condition. So it's very likely that that thyroid condition, which was diagnosed a few years ago, it was an autoimmune condition already, which you got to know now.
All right. Yes, ma'am.
So usually it's a T3, T4, TSH, which is done in general to know a thyroid function. And the autoantibodies are missed, and you only get to know it 5 years, 10 years down the lane when your symptoms are just deteriorating. So she had she had an autoimmune condition few years back already, which was not addressed, and the symptoms, various symptoms was showing up, and something or the other. Okay.
Yes. Yes.
And it can definitely be addressed. The root causes that are in play, which can be nutrient deficiencies, heavy metals, gut infections, mitochondrial dysfunction, so many things. We can evaluate that with the help of detailed investigations and detailed signs and symptoms,
Mhm.
and address that with the right kind of food, right lifestyle changes, right supplements, and various other things that she can change in her life, which will make recovery possible for her.
Yes, ma'am. Will 3 months be enough for us to tackle all these problems?
No, it will not be enough, but it is enough for you to start seeing a change in your health. Start seeing that your health is moving in a positive direction. Something that has been there for years cannot resolve in 3 months, but you will start seeing that things are working for you. Your symptoms are getting better.
Yes, ma'am. Yes,
We will
ma'am.
6 to
Please
9
continue.
months for complete resolution.
I would also like to highlight over here is that she's taking Pan D, Pan 40 in the morning. That's how she starts her day.
It's not good for her. She's basically suppressing her stomach acid, which will further deteriorate her gut health, and in
That,
turn
yeah.
affect further her autoimmunity.
Yes, absolutely. This is what exactly is happening with her.
Yeah.
Yeah.
So if she is willing, we can definitely help her come out of this situation.
All right, ma'am. Thank you so much.
Okay. Okay, we'll take one last question. Ridhima, you can unmute yourself. And anybody else, just 1 second, Ridhima, anybody who wants our team to connect with you, please leave your numbers. And we hope you've answered the poll. Okay, Ridhima, please go ahead.
Hi, can you hear me?
Yes, yes.
Hi. Thank you so much for the session. I think almost all of the questions have been answered for me as well while I was listening to rest of the people. I just wanted to understand if you have a physical presence as well, or this entire course is only online.
So our program runs only online. That's the nature of our practice. All our consultation practice is everything online.
Okay. And see, as far as so far, whatever I've understood, there is a certain kind of lifestyle which is required to be followed post all the diagnosis and everything is done. Has there been a situation wherein somebody is not able to follow that kind of a lifestyle? Is it easy to follow or is it difficult to follow?
Okay, so now see, that's what is the beauty of a program, right? If I just give you a plan and tell you that, okay, you have to just now follow it, that will be difficult. We provide them holding so that as you implement it, if there are hiccups, you can come back to us. And also we give you everything possible that you would need to implement that plan, be it recipes, be it handout, shopping list, everything. Okay, because when you're changing your diet, especially, I mean, we are so used to eating a certain food in a certain way, right? So we provide you all the hand-holding you would need to start switching to the changes that we have recommended. And once you start seeing the changes in your body that the new food brings in you and the new lifestyle, you will not be inclined to go back to your previous habits.
All right. Okay. And there's nothing like a pre-mixed food diet from.
Oh, no. Well, then if you're just giving you a premix diet, again, it's how different it is from other processed food.
Anyways, Ridhima, please
Yeah.
So pre-mixed, you mean like somebody is making and sending it to you in a packet, or you're saying like a common
Right,
diet
right.
for everyone?
Yeah, that is what I meant to say. Because a lot of people, they tell you that, okay, we'll help you with these things, and then they'll send you their diet. Okay, you follow our
No,
diet,
we
and
are
then
not
they charge
interested
you
in
bomb.
selling. We are not selling any food. Okay. We're not
Okay.
interested.
I
See, anyways,
just
please
wanted to.
understand also, Ridhima, that these kind of ailments have come because we have done wrong things with our health, our body. Okay. And a
Absolutely.
large part of the healing process is learning. Unless, so if I give you food, I package the food and send it to you every day, you will never learn how to make the right food for yourself, right? It
True.
won't lead you towards healing. The journey will be a little more difficult initially, but you will go much further if you do it to yourself, right?
Absolutely. I just wanted to understand this because need something which is sustainable for life and not something which is temporary.
Exactly.
Right. All right. Thank you so much.
Okay, all right. Okay, one last question. Khushbu, you can go ahead and mute yourself.
Hello.
Khushbu, you can unmute yourself and ask.
Hello, ma'am. Last year,
Yeah.
I was diagnosed with hypothyroidism, and they started with a MCD of medicine. And after that, the symptoms were quite high. So they included 60.5 MCD. But during my research, I found out that I read some articles in online, and I did my research.
Khushbu, you're not audible clearly. There's a lot of disturbance.
Is it audible?
You are audible, but then there's a lot of disturbance.
Noise.
Yeah.
Okay. Is it better now?
No, not able to hear them.
Maybe, yeah.
You
Is it
can
better?
give your number. Yes, that sounded a little better.
Okay. So actually, what happened last year, I was diagnosed with hypothyroidism, and they started with 50 mcg of medication, and they simply told that you don't need to do anything, just improve your lifestyle and nothing. You don't need to have any diet and all. But I I stopped taking gluten and dairy from there itself, and I did some research and all. So I know I did test of anti TPOs, and it came out to be 100,000 and above. So after that, now I'm totally on gluten-free and dairy-free diet. So how long will it take for my antibodies to come down to a lower level?
So, are you just on a dairy-free and gluten-free diet, right? Is that all you've done?
Yeah.
Okay. So that alone is not enough to address the autoimmunity.
Okay.
And in our experience, it takes 6 to 9 months, right? 9 months is a good time to bring, of course, in 3 months, we will see some improvement. Okay. Six
Okay.
months, more improvements. And in 9 months, we see a significant drop in the autoimmunity levels.
Okay. Okay. Thank you so much, ma'am.
Okay. All right. Okay. All right. So now, okay, we take one last question and then we will wrap up. Dimple, please ask your question.
हेलो मैम
Yes.
मैम मेरा पीजीआई से ट्रीटमेंट चल रहा है मेरा एसएलई ल्यूपस सेकेंडरी हेलो
Yes,
Yes,
we can.
yes, we can hear you.
सेकेंड एपीएस का था और मुझे पल्मोनरी एम्बोलिज्म थ्रोम्बो एम्बोलिज्म हुआ था डीवीटी भी हो चुका है मुझे एक बार काफ मसल में काफी मतलब रेसेस हो गए थे ब्लड क्लॉट हो गया था मेरे लंग्स में अभी जस्ट मैं 26 सितंबर में डिस्चार्ज हुई हूँ 10 डेज के बाद पीजीआई लखनऊ में। और उसमें बहुत सारी चीजें, माइग्रेन भी है मुझे, मेरा वेट 110 kg है और 102, 103, 104 इसी अप्रोक्स लगभग 2 साल से है मेरा वेट। और माइग्रेन और सर का तो ये बहुत क्रॉनिक हेडेक बना रहता है मुझे, परमानेंट। और बहुत ज्यादा स्ट्रेस रहते हैं, बहुत मतलब लाइट फील नहीं होता है। तो इन सब चीजों के लिए मैम मतलब कि मुझे एपीएस, मेरा एसली ल्यूपस पेशेंट हूँ, सेकेंडरी एपीएस ट्रिपल एंटीबॉडी पॉजिटिव है मेरा, एपीएस
Okay.
ट्रिपल एंटीबॉडी पॉजिटिव है। तो
All
मैम
right.
इसका कोई
So Dimple, we
ट्रीटमेंट
will
है
play.
आपके पास?
बिल्कुल बिल्कुल है। दिस एंटायर वर्कशॉप वाज अबाउट ऑटोइम्यूनिटी। हम सिर्फ ऑटोइम्यूनिटी की ही बात कर रहे थे ऑल द वाइल। बाकी जिन्होंने भी क्वेश्चन पूछा है, यही पूछा है कि क्या हम रिवर्स कर सकते हैं ऑटोइम्यूनिटी। सो वी विल शेयर, वी विल शो अ वीडियो व्हिच इज फ्रॉम वन ऑफ द clients we worked for 3 months, and in 3 months she saw significant improvement in her autoimmune condition, and she was diagnosed with RA. She was diagnosed with Sjogren and MCTD
There was
condition.
one more. She had 4 actually total.
I think Ankylosing Spondilitis as well. Yeah. So Siddharth, why don't you play that video?
Hello all, this is Aparna from Hyderabad. Few months back I've been diagnosed with MCTD, which is called multiple connective tissue disorder. It's an autoimmune condition where multiple autoimmune disorders have been attacking my immune system. At the same time, I had RA, rheumatoid arthritis, then I had Jordan syndrome, which had affected my eyes, and I had many other conditions also. I mean, my symptoms were I used to wake up with pain, and especially in my left wrist and my thumb joints. I used to wake up with pain every day in the morning, and my eyesight started to, become very blurry. And then I used to have this brain fog, very, very, very lethargic, and no mood to do anything, or low in energy all the time. But one day I came across Hormone Research over Instagram and I contacted them. I took over the plan, very sustainable plan. I could make over the changes. I think within almost 3 weeks, I was able to adapt to the plan very easily. And very good supplements which started to show impact very quickly. My hair fall started to reduce. My acne marks have gone. My skin started to feel much better. And then I started to have a burst of energy all throughout the day. Today, now being the monsoon season, I can wake up without pain in the smaller joints that I have, but otherwise I feel very, very good and happy after taking the plan from Hormone Research.
So, okay, I have just one last slide for, especially for people who are still here in the workshop. So, what kind of food you should be eating? So, this is what an autoimmunity diet should be like. This is just a guideline. When we work with individual cases, we customize the diet. So, but this is what, in a nutshell, an autoimmunity diet should be like. This is for those of you who have asked what you should be eating if you have autoimmunity. So with that, we will end our today's workshop. There are still some hands raised, but we will have to wrap this up. So please reach out to Tushar. He has shared his number in the chat for any further questions that you have. We have the special price, the discounted price, only valid till tomorrow 10 a.m. So if you want to join the the group program or the individual program, please sign up right away so that you can benefit. Tushar has shared his number. You can connect with him for any questions that you have. So, okay, thank you, everyone. And if you've not joined the WhatsApp group, please do join.
Thank you, everyone.
Thank you for being a part.
We were able to add some value to your life today, and we definitely look forward to helping you become a much better and healthier version of yourself.
Yeah.
Thank you. Namaste. Good night, everyone.